And good day from Kingston, Jamaica. I'm Julian Rogers, and welcome to Caribbean Bridges, the conversations about our common destiny. A special welcome to Barbados today as we look at the impact of COVID, but with a twist by looking at all the other health threats facing our region. We're not here to downplay the impact of COVID, but to remind all of us of the importance of dealing with diseases and health issues that could claim even more lives than the pandemic has as yet. Joining me is the Chief Medical Officer of Health in Antigua and Barbuda, Rhonda Seeley Thomas. Trinity to the bone, but Caribbean to the core. And there's what some may call a voice crying in the wilderness wrought by COVID, Dr. Adrian Lord, a family physician and sports medicine doctor. And help us appreciate the impact on our psyches is clinical psychologist Dr. Khadija Khan of Trinidad and Tobago. So welcome everybody, wherever you are, around the region and around the world for that matter, thanks to the internet. And let's spend an hour together right here in our Caribbean Bridges. I'm going to begin with Rhonda, give her an opportunity to give us a quick look at the COVID situation in Antigua and Barbuda, and then I pointedly ask her about the other threats beyond COVID. Welcome, Rhonda.
Good afternoon, Julian, and good afternoon to the other guests, and also to the wider Caribbean and anyone who's listening on the World Wide Web.
So let's talk about the COVID situation in Antigua before we go into the other threats. What's the latest?
Okay, so our latest dashboard would state that up to now we've had 419 laboratory confirmed cases of COVID-19 in Antigua and Barbuda. We have currently 211 active cases, and we have now had 9 deaths. We saw our first case in March of 2020, and since then we've seen an increase in the number of cases, culminating in a total number of 419 cases. And we've seen about 3 waves like other countries, and right now we're experiencing an increase in the number of cases.
Overall, what would you say is the impact on literally the country, so to speak?
The impact has been quite a challenge for everyone in Antigua and Barbuda. As healthcare providers and as public health persons, we've been told by the Pan American Health Organization and other public health institutions to prepare for a pandemic, prepare for an outbreak of a respiratory disease, but nothing could have prepared us for COVID. In terms of Antigua and Barbuda as a whole, it has had a significant impact on our economy. As you would be aware, Julian, we depend heavily on tourism in Antigua and Barbuda. And what has happened is that because of COVID and the restrictions on travel, we've seen it has really impacted our tourism industry in Antigua and Barbuda. So I would say the healthcare system is resilient, but it has been a challenge, and also our economy has been affected as well.
And you can't go to the beach.
Right. There have been restrictions on us going to the beach. And we have 365 of them. So it's really been that's been hard on us as well.
That's very difficult for me to contemplate, having lived in Antigua all these years. And I think maybe I'm in the right place, right? At least I can get out to Ocho Rios now every now and again. But anyhow, let's so that's the so-called dashboard for Antigua and Barbuda. You talk about the medical facilities there, and I want to ask you to talk about what you got. You got the St. John's Medical Center, and what else?
So we have the Mount St. John Medical Center, which has about 187 beds. We have an ICU there. But even before COVID, in fact, after the threat of Ebola, the government decided to build an infectious disease center, separate and apart from Mount St. John, which was actually at the old hospital compound. You remember Halberton Hospital,
yes.
Julia? So we actually have a 17-bed infectious disease center there. It's fully equipped with ventilators, isolation facilities, and it also has facilities where staff can be accommodated in terms of living in. So we have that, and then recently we've have a sort of a step-down facility where persons who are confirmed with COVID-19 but may not have symptoms but need to be isolated. We have another facility now where we can house them. So we actually have 3 facilities: the Mount St. John Medical Center, where we actually have an ICU, but we call a COVID ward, where we can have isolation of persons with COVID. Then we have a separate infectious disease center, and then we have a separate step-down facility for not so severe cases.
One other thing is, what is the situation with regard to vaccines? How soon are you getting them?
So actually, we do have vaccines on island now. We do have 5,000 doses of AstraZeneca on island, and we're planning to roll out and start vaccination in terms of our healthcare workers and other persons more at risk next week.
All right. So there's good news. We'll come back and talk about vaccine resistance, etc. But let me move to Dr. Adrian Lord in Barbados and give you, Adrian, a chance to tell us, because I understand the number's gone up again today.
Yes, Julian. Good evening, everybody throughout the Caribbean bridges. Yes, Barbados, we are swimming in a big tide. We had 2 additional deaths today, actually, in the last 24 hours. Our total number of cases of yesterday, because we haven't had a total for today, was 1,947. And this is significant because at the end of last year, 2020, we were at 395. So we've had over almost 1,600 cases, and our deaths have tripled since last year. Last year, we were 7 for a long period of time, and now we are at 23, which I personally am not sure what the reason for that is, if it is a new variant, but more cases are being diagnosed in 2021. We have curfew in place. We have had 110,000 tests done. In the last week, we've had something like 291 cases. And so we're seeing a rise in the number of cases per week as we per day virtually as we go along. And it's concerning to us. Our borders were never closed, and we have, in December, we had an influx of Barbadians returning from the USA and UK and Canada, in addition to the tourists who came in. And some didn't behave as good as they should have, and hence the spread.
Wow. So there's a worrying situation. Certainly, we've had our spike here in Jamaica last year as well, and that was very worrying. And we got a recent increase again, which is forced the government into instituting a tighter curfew hours. So we are really at 8 o'clock every night now until 5 o'clock in the following morning. We are on the curfew across the country. All right, we get back to a lot more of that, but let me also give an opportunity and welcome to Khadija Khan, who is a clinical psychologist there in Trinidad and Tobago. Khadija, what's the latest?
Hey, good evening to everyone. Thank you, Julian, for having me on the show. So I'm actually going to our Ministry of Health released some figures, the latest dashboard an hour ago, so I can give you those figures. So since the pandemic started, since we had our first reported case on the 12th of March last year, we've had 7,642 cases. Currently, we have 170 active positive cases, and of those, 26 are hospitalized. The rest are being allowed to recover at their homes. Since the pandemic started, we've had 138 deaths. And so people are being allowed to quarantine at home, they're being allowed to recover at home, and it's only the more serious symptomatic cases that are being treated at hospital. With respect to the public health prevention measures that have been imposed and are still in place, our borders are still closed, and we do have some citizens who are waiting to be repatriated, and so the government is processing those on a case-by-case basis. We have mandatory mask wearing. We have, most stores have mandatory hand washing and sanitizing before you enter store. There was a time when we had our second lockdown when we were prohibited from going to beaches and congregating. So for example, restaurants, you weren't allowed in-house dining, but now they are allowed at 50% capacity. Cinemas are open at 50% capacity. The beaches are open. You're not allowed to congregate in numbers of 10 or greater. And I think that's a bit of a challenge, because this is Carnival weekend for Trinidad and Tobago, but we've had to adjust and figure out how to celebrate in a safe way. So that's a brief update of what's been going on here.
But it's really. I'm glad you made the reference to the fact that there's no carnival in Antigua, in Trinidad and Tobago, for that matter, and in Dominica there would have been carnival as well. So really and truly, you're not alone in not having carnival this year. But I was thinking back to Kitchener's Rhinorama, etc., and recognizing that the only thing that has ever stopped carnival certainly is COVID. That's got to be historic. All right, so let's go then to the subject at hand. And deliberately, I said to all of you, look, there clearly is a need to talk about the fact that there are other health threats beside COVID. In fact, some of them are even more serious than COVID in real terms. And I want to go back to Rhonda and let her talk about the situation in Antigua, and specifically to zero in on the challenges of dealing with these additional threats.
Thanks, Julian. And to talk about other things, other health threats to Antigua and Barbuda, aside from COVID, of course, you have chronic non-communicable diseases, diabetes, hypertension, cardiovascular disease, stroke, and cancer. And those chronic non-communicable diseases have had an impact on COVID, and COVID has had an impact on them. But we'll talk about that later. And then you have other things, communicable diseases, the dengue. A couple of years ago, we saw chikungunya and Zika, and those are caused by the same vector, the Aedes aegypti mosquito. So vector-borne diseases are also a problem. So I think, things like chronic non-communicable diseases, vector-borne diseases, of course, HIV/AIDS. We've made a lot of progress in terms of HIV in the Caribbean and in Antigua and Barbuda, especially when it comes to antiretroviral treatment. But we have to keep on the ball if we want to continue to see the number of cases decrease and reach the global targets with regard to HIV.
So you got that situation, and I want to when I asked you to look at the challenge, of course, of dealing with these, because obviously you got a dedicated infrastructure in terms of the COVID ward and all that kind of thing, but talk to us about the challenge of meeting these other treating the people who are facing these other diseases and illnesses.
So yes, Julian. For example, if we look at chronic non-communicable diseases, even before COVID was a challenge dealing with them. The chronic diseases, you have a difficulty with persons being compliant with their medication. Their lifestyle diseases, things like alcohol, tobacco, obesity, and increased salt and sugar intake lead to risk factors for those diseases. And even before COVID was a challenge having persons adopt those healthy lifestyles that would prevent them from becoming sick with NCDs. And then when they would become sick, eventually succumb to these diseases, for them to be compliant, it has been a challenge. With COVID, one of the things we did last year, when we had an increase in the number of cases, we had to really curtail the number of visits to the hospital. We have outpatient clinics where diabetics and hypertensive patients would go to the hospital. We had to curtail those visits to the hospital. And also in community, what we found, although we tried to continue the care for those persons, we found that persons were actually staying home. Although we would tell them, make an appointment, and we put things in place to reduce the risk of getting COVID when they would come out. But a lot of them told us afterwards that they really were afraid to come to the clinic during the pandemic. And what we saw afterwards, when our lockdown was stopped, a lot of persons came in uncontrolled because they had not come to have their prescription refilled and to see them at their practitioners. So that was a challenge for us during COVID with chronic non-communicable diseases.
So that really is a situation, one of fear brought on by COVID. I know that people have been advised, in fact, call the doctor first if you feel a certain way, and then the doctor will advise you to come, whether you come there or whether you try to get a test, etc. All right, and let me then ask Adrian about the situation in Barbados. What have you experienced?
Yes, as a family physician, I've experienced similar cases such as Rhonda mentioned. I'm out on the front line. She's sitting in her office most of the time. But the right, Rhonda?
She may dispute that.
Yeah, but yeah. So we have the chronic non-communicable diseases out there: the high blood pressure, diabetes, heart disease, persons with high cholesterol and obesity. The fear is that with the lack of physical activity, which is primary part of management of these diseases, and we're restricting physical activity. And right now, you can only exercise in Barbados between 6 a.m. and 9 a.m. and the beaches are open only those 3 hours, no sporting activity. The problems of the compliance with exercise is there. Plus, coming to the doctor, we tell people to stay home, stop home, don't go anywhere. Plus, it's also difficult, especially now, to get to the doctor if you don't have your own private transportation, because the buses and the minibuses, the private buses, are not running as often as they would be. And that also has implications for people who are on medication to get repeat medication. The other problem is that since people are not working, they might not be able to go to the doctor. And as far as the polyclinics, which are the public clinics, are concerned, they're being consumed now with PCR testing. And from Thursday last week, we started vaccinations. We're doing the immunizations against COVID-19. I got mine in my arm here. Some people don't believe me, but yes, I did. And yeah, so now all today and all yesterday, and I've been out there too, monitoring persons after they've had the vaccines to see that there are, no problems occur. And also as a voice to try to encourage persons to take the vaccines when their turn comes. The healthcare personnel have started, and then we have registered persons over the ages of 70. And from today, we are registering persons between the ages of 18 and 69. So we're doing a phased approach to the immunizations. So the healthcare workers are consumed now with COVID-19. So the impact of the chronic non-communicable diseases and the communicable diseases, because we're seeing dengue as well, we've had a few deaths from dengue, are being felt. Now, the accident and emergency department, where persons would enter, has had its fair share of COVID-19 cases. We in Barbados were fortunate to build a hotel. Sorry, I call it a hotel, but it's really a hospital, a 220-bed hospital for COVID-19 patients. They have primary, secondary, and tertiary sections, and anybody who is deemed positive with a PCR test, they would be taken there. In recent, and that's the primary center. Recently, you also have the persons can go to the secondary center, and then there's some hotels, isolation hotels, until your time is up, so to speak. But the impact of COVID-19 on the healthcare services, and we haven't even looked at things like the other immunizations, the well baby clinics, the people who need to go for their mammograms and their pap smears, people who need to go for their other routine medical care. That is being affected because people are either not working, cannot afford to go to the doctor, and the public clinics are consumed with the COVID-19 testing and now immunizations, and then lack of transportation and the fear of going out in public is also there.
I can only describe that as a kind of a cocktail that is really not to be consumed at all in real terms. Which brings me to the point of the impact overall. And this is a good point for Khadija to jump in here and talk about the many impacts on the population, not just in Trinidad and Tobago, but certainly you're talking to your colleagues across the region and learning a lot more about what's happening there.
Yes, certainly. So at the very beginning of the pandemic, it was predicted by mental health professionals that we would have a tsunami of mental health issues. And time will tell exactly what the size and scope of that problem is. But what we do know, and this is across the board, all countries, regardless of whether their rates are higher, even as the rates are changing, we do know that everyone is under heightened levels of stress compared to pre-pandemic. So in addition to the everyday stresses that people have to deal with, they now have the heightened level of stress because of the pandemic. So whether it's dealing with a global health pandemic and all of the changes that have come with that, many people have had life changes and strains. Many people have been affected financially. So many people have lost their jobs or they've had lowered incomes. So we are seeing the financial fallout of the pandemic, small businesses having to close, etc. And we're also seeing significant changes to people's lifestyles. So I mentioned the closure of the borders, but we still also have many countries where schools are still closed. So children and families have had to adjust to online schooling. And as we know, first there was the adjustment period, having to adapt to these new changes. And as this pandemic continues, we're now hearing so much more about Zoom fatigue, about the ongoing potential fallout of digital poverty. So many children in so many countries across the Caribbean do not have access to devices, do not have connectivity. And so the idea is, what is going to happen to them 5 years from now? Are they going to be able to catch up? Or are we going to see a widening of the disparities and the inequities we have in society? So we're seeing then an exacerbation of psychological problems and social problems. Just tying back to some of those psychological problems, what we do know is that the stresses of the pandemic not only are going to worsen people's mental health, so in terms of whether it's anxiety or depression, but also if you have an existing mental health issue, and we've heard that alluded to with some of medical conditions, this pandemic has the effect of exacerbating these mental health conditions for many reasons, the different stresses as well as their access to care and treatment. And finally, I think one of the biggest things we need to put our finger on is we have recognized that because of the restrictions and the closures, for people for whom home is not a safe space, we are seeing now a gamut of problems because of that. So domestic violence, gender-based violence for children, an increase in all forms of abuse, psychological abuse, sexual abuse, physical abuse. We're seeing people with substance use problems. So even for perpetrators who prior to the pandemic would have had outlets, they would have been spending more time outside of the home, doing other activities. Now, for homes that are toxic and dysfunctional and abusive, it puts people more at risk. So we are seeing some of the fallout of that, and we do need to be prepared to deal with it, because it is going to call for even more resources in the height of a pandemic where resources are already strained. And finally, now that we're at this stage where we have a vaccine that's available, we also have to acknowledge that many people have vaccination anxiety. The conspiracy theories are rife, and so many people are saying, I don't know if I want to take it, or I'm going to wait. Let me wait 6 months and see what happens to my colleague before I take it. But the vaccination anxiety and the anti-vax movement is also something we have to monitor as well.
We're going to get a chance to talk more about that with the other guests. Of course, that is Khadija Khan, Dr. Khadija Khan of the Trinidad and Tobago. Also with me is Dr. Adrian Lord of Barbados, and out of Antigua and Barbuda, the Chief Medical Officer there, none other than Rhonda Seeley Thomas. And let me remind you that you can send your comments and questions in. The facility is available there on your screen, so you know exactly what to do. And we'll certainly pose it to our guest here. I want to pose the question, though, to both Adrian and to Rhonda to talk some more about the vaccination, because, you know, I think it's appropriate that we try to dispel the kind of rumors and anxiety and misinformation that surrounds the vaccine. For instance, the Governor General of Barbados got her shot a couple of days ago, and already people are suggesting that she didn't really get it. So, Adrian, can you clarify? Because I know you showed me and I asked you to demonstrate exactly what really happens.
Yes, Julian, it's really unfortunate that did happen, that people look for, try to create some doubt in the whole thing. The Prime Minister also got shot a few weeks ago, and she didn't record it, so people don't believe it. So there's a dozen Thomases out there. And all that happened with the Governor General, and as, lay people wouldn't know, the needle that you draw up the vaccine with and the needle that you give the vaccine with are two different sizes, and two different colors as well. So person saw one color, I think a blue needle was used to take the vaccine, and then an orange needle was used to put the vaccine into her deltoid muscle of the shoulder. And they said, no, that they tricked you. So people are as was mentioned by Khadija, the anti-vaxxers are looking at all little things. Yeah, the vaccine that we have in Barbados is the AstraZeneca, the Oxford AstraZeneca vaccine, developed in Oxford in association with AstraZeneca, which is a company that's been around for many years, working with all sorts of drugs, hypertension, diabetes, antibiotics, all sorts of drugs. But they worked on it, and people are concerned about the rapidity with which the vaccines have been developed. The COVID-19 started in December 2019, and by January, the genomic sequence, the backbone of the virus was really recognized, and therefore they worked on it from then. Because of scientific breakthroughs and technological advances, they did not have to, plus in addition to the money being placed in it and the red tape that you normally need to go to do studies and so on was not there. It was pretty quick to get to this vaccine. And several companies, over 50 companies have been working on the vaccine. We heard of the Pfizer, BioNTech, and the Moderna in the USA. And now the World Health Organization has also approved or authorized the Oxford AstraZeneca, which we were fortunate in Barbados to get 50,000 doses. Some of these doses were sent to some of the other islands, as well as Dominica also sent them to the islands, and that's why Rwanda got some from Dominica. And we have started our immunizations here, and it's been going pretty smoothly. No adverse reactions except for the soreness in the arm. Some people got fevers, some people got chills and muscle aches, and that is normal for any vaccine. So there's no need to worry. And the good thing about this particular vaccine that we have here, it is suitable for our climate. Whereas the mRNA vaccines have to be stored at minus 70 degrees Celsius or minus, I think, 20. This one can be stored in your refrigerator that you can buy from down in town at your nearest hardware store. And therefore, the cold chain can be more easily maintained. And therefore, it's quite suitable. Plus, in addition to the effectiveness of this vaccine, it has also been shown to reduce the transmissibility, which some of the other vaccines have not been shown in 76.3% of cases. This is given in 2 doses, one now and one in 4 to 12 weeks after. And this is how it's being rolled out. And it's rolled out on a stage basis where we're looking first at the healthcare workers, then the vulnerable people, and then the frontline workers, and then the vulnerable people, persons over 70s, and then 18 to 69. And then hopefully we'll do the second dose next month.
I want Rhonda to pick up here, but specifically to respond to this question. We have lived with vaccines over the years. I mean, yes, as children, we had to be vaccinated. We didn't have a say in the matter. And therefore, I ask you, why is there such concern if everybody was very, very comfortable with the fact that if you had to travel to another Caribbean country or another place somewhere in the world, you had to get vaccinated for one disease or the other? Why do you think that there's a skepticism exists in the first place?
Yeah, and you're right, Julian. Vaccines have been with us for a long time, and they proved to be successful. In the Caribbean, we've eliminated polio, measles at one point in time, diphtheria, other childhood diseases we don't see anymore, and that's a result of our very successful vaccination programs. There have always been skeptics for vaccines. You always have those anti-vax persons, and there's always been vaccine hesitancy. What we've seen with COVID is that there's been an increase in the number of persons who are very hesitant or very skeptical about vaccines. That could be because of social media. The word would have spread quickly about the messages about anti-vaccine campaigns. So you'd find that persons would be more privy to the information that the persons who are against vaccines will be given. The other thing is to, as Adrian would have mentioned, people are skeptical because of they think it's been developed too quickly and that not enough research had gone into it. They don't recognize that we're living in an era now where the technology has advanced quite rapidly. So as Adrian said, they were able to develop the genetic sequencing for this virus very quickly, and in that way develop a vaccine in rapid time. So I think that's the reason why persons have been hesitant, and why we have this anti-vaccine these anti-vaccine campaigns being more prevalent now. I think social media and the ease of communication and the fact that it happens so quickly for this COVID-19 or COVID-19 disease.
And would you say that is there any way of determining the level of skepticism, or is that your expectation is that really the campaigns, the public campaigns being conducted across the region by prominent people, etc., and by specialists like yourselves, etc., should lead a great deal to reducing that skepticism?
I think public education is key in reducing that skepticism, but I think surveys and other means of finding out why people think they do, what their real fears are, I think those would allow us to reduce the skepticism even more if we get to the root cause of why they're afraid of the vaccines. And some countries, and in Antigua and Barbuda, we are planning to do as well, conduct studies to find out why there's this vaccine hesitancy. And despite what comes out of those surveys, we still have to do public education, but it would have to be more targeted based on the results of those surveys.
Adrian, I want to shift off the COVID, so to speak, and get back to the original question, really about the other threats, and to get a better sense of where we are with these kinds of diseases in the region, because all the doctors that I talk to talk about how serious they are and how we must pay a lot more attention to them, and in the current situation they could get bypassed, etc. So that we really need to zero in on the most critical and do something about it for the public.
Yes, this is a critical issue. Yes, COVID is there, and we know that, you say you're shifting off COVID-19, but you know that persons with the chronic diseases do worse if they contract COVID. But the other diseases are wreaking havoc with our societies. High blood pressure, diabetes. Over a third of persons have at least one chronic non-communicable diseases. And therefore, we have been working through the Healthy Caribbean Coalition and other groups in the Caribbean, through CARICOM health ministers, to try to fight these diseases. And then COVID-19 came and cat's-paddled everything. And we therefore need to get people to concentrate, and we need to focus still on the chronic non-communicable diseases, the cancer prevention strategies that we have in place. And I mentioned the well baby immunization, and Khadija will talk about the mental health illnesses that are out there. So it is still on the front line, on the top of the table, and we need not to get carried away by putting all of our focus and energies and resources, monetary and financial and human resources, on COVID-19, with the exclusion of all the other chronic diseases that are there and causing significant havoc in our societies in the Caribbean.
And as you talk about resources, are we stretched because we have to put this additional focus on COVID-19?
Yes, we are definitely stretched. The testing, the human resources. As I said, in Barbados, we set up a whole COVID-19 hospital, 220 beds, equipment, ventilators. The nurses, fortunately, we got some help from Cuba and some from Ghana, nurses. So it is really stretching, and it is consuming the health authorities in our country and within the whole Caribbean. It is affecting us, and therefore the society is besides the fact that other businesses are suffering with the shutdown that has occurred, it is putting a lot of stress on our societies. And the anxiety they're developed, it has further affected the mental health and well-being of our families.
And that, of course, is a great lead-in for Khadija to come right in here and talk about the situation in Trinidad and Tobago, a country where, hey, given the chance, everybody want to play mass or enjoy themselves, go to the beach, go to the rivers, and have a good bit feast with curry duck and whatever. Must be a radical change in that society.
Oh, indeed. And so we've had to be responsive, we've had to be agile, we've had to be creative, because, and I think I speak on behalf of the country, that I have to put a caveat to your statement. Carnival has not been cancelled. So we do have a carnival, it's just a transformed COVID-19 version of a carnival. So there have been lots of online events. Last night we had the International Soca Monarch competition. There are other online events, artists are holding concerts, etc. But of course it's not the carnival we usually have. So for example, there will be no Juve, there will be no road parade on Monday and Tuesday. So certainly that takes its toll on people. For the huge section of the sector that depends on carnival for an income, so all of the persons involved in that sector, tourism, all of the mass producers, etc. But also, you know, we often think of carnival as our country's release. You know, our stresses are building, and it's like a pressure cooker. It's building, and carnival gives us an opportunity to get an annual release, and then we get the release, and then come Ash Wednesday, we continue until it builds again for the next year. So, in terms of, we're all trying to cope with the carnival withdrawal symptoms, even for persons who don't directly participate, but who use carnival as a chance to get a retreat, get a little rest, whether they go to Tobago and relax a little bit. So it certainly has been a bit of an adjustment. But apart from carnival, what we have seen, you know, again, we have, as I mentioned before, many of these psychosocial issues that we're facing. And because we're in a pandemic, it doesn't mean that it's the only thing that we're dealing with. As you said, that's the topic of what we're talking about today. So for example, one of the things that we are dealing with is really a massive gender-based violence issue. So we've had to deal just this year alone with some really violent, brutal, devastating deaths of women in our country. And amidst the tragedy, one of the positive things that's coming out of it is a galvanizing of a community response and a national response. So we've had a lot of people being very outspoken, in addition to the usual activists who are doing a lot of work, who've been doing work for many years. We've had just average people in communities come out, speak out. We've had many vigils over the past week because we've been dealing with a very tragic death a couple of weeks ago. So I think amidst the pandemic, we're also trying to figure out how do we deal with these other social problems, and how do they intersect with the issues that the pandemic is facing. As I mentioned, does it make us more vulnerable to perpetrators, to acts of violence, to abuse, to worsening mental health? And if I may return, Julian, with your permission, to the issue of the vaccine anxiety, one of the factors I think that has caused this resurgence in recent history is in 1998, a scientist, I'm not going to say his name, published a study that suggested there was a link between the MMR vaccine, the mumps, measles, rubella vaccine, and autism. And so, although he had a very small sample size of just 12 children, it was published in a very prominent journal. Now, subsequent, it was totally debunked. The journal retracted the article. It was soundly criticized as being very flawed, but the damage was already done. So people have this idea, and that unfortunately still persists, that vaccines are harmful. And so you had a number of international celebrities who were also suggesting that. And so that movement got more traction. So that in recent history, and I'm sure the doctors would be able to speak about this, we were seeing a resurgence of things like measles in the USA when they hadn't seen outbreaks of measles for decades. So those seeds were planted, and I think now one of the consequences of that is that people are now questioning the vaccines, and in terms of, can we trust the scientists? Can we trust these large pharmaceutical companies? So it's an issue of trust and integrity in the public's opinion. And so from a psychologist's point of view, that part is very pertinent, because we do want people, in order for people to be compliant, to be willing, they have to believe in it, they have to trust it. And so I think it's really important that we tackle, if we see those sentiments being expressed in our societies, we have to be able to tackle it, address people's fears, address their concerns. If they're worried about side effects, we provide the psychoeducation at a level that they can understand. So we explain their concerns to them, because we do have to allay those fears. Because until we get to the point where we have a widespread vaccination, it's going to continue to be people's behaviors that are going to keep us safe. Okay? So I'll stop there.
All right. And I can't believe that I missed the Sotomayor competition, and the fact that, that my good friend Farmer Nappy won with his backyard jam. Congratulations, Farmer Nappy. And congratulations as well to Olatunji, who came in second there. All right. So I want to give you an opportunity to respond to one of the questions posed by one of our viewers, asking about our ability, with our expertise across the region, what is the possibility of our involvement in the manufacture of vaccines? Who would like to take that? Rhonda?
I could attempt it, yeah. I think it would be a challenge for small countries, certainly for Antigua and Barbuda, to take on the task of manufacturing vaccines. It takes a lot of research and technology that we don't have in Antigua and Barbuda, certainly. Cuba is one country in the Caribbean I know that has the technology, and they have been, in fact, manufacturing vaccines. But for small island states like Antigua and Barbuda, I don't see that in the near future. Where we can probably fit in vaccine development, maybe in clinical trials, if members of the population, we could be possibly included in that way when the vaccine companies are conducting their clinical trials.
All right, so there we are then. So our best bet really is Cuba, who clearly have done an amazing job in the medical field, not only in working on vaccines such as they are with COVID-19, but certainly assisting many countries, not just the Caribbean, but around the world, with doctors and nurses and other experts as well. As we talk about the work, possible work across the Caribbean, I want to ask Adrian to look at the matter of the investment we make in health. And I know that in a lot of budgets across the Caribbean, health does get a sizable chunk of the allocation. I think education turns out to be the biggest thing. But now, is it proven now that we really need to invest far more in health? And what should that approach be based on the focus that we've identified of these additional threats other than COVID?
Yes, we need to look at our priorities and look at our landscape as far as the health problems that we do have, and therefore then based on that allocate the appropriate resources that is necessary to help to fight these diseases. So we might look at the top 10 causes of death or top 10 diseases that we see out there and determine how we are fighting them, what we are doing, what is needed to be done, how we could communicate to the public that they need to fight these conditions even more, and then allocate more resources to these outside of the COVID-19 situation. And of course, look at the different sectors and age brackets. The elderly and people are living longer in the Caribbean. A lot of our population is over the age of 65 and over the age of 75. And then we need to look at the young children as well. And then the ones in between there. So we need to look at the various levels of health expenditure and therefore adjust our budgets to suit. But after this pandemic, we have to look at what damage has been done, what are the lessons learned, and what is the way forward. And I said after, I don't know when that will be, but we need to take all of these things, the lessons learned, and the way forward.
All right, let me remind you, this is Caribbean Bridges. I'm Julian Rogers. I'm in Kingston, Jamaica. The last speaker, of course, Adrian Lord in Barbados. And we've got Rhonda Seeley-Thomas in Antigua and Khadija Khan in Trinidad and Tobago. And it's to Khadija I'm going to go because with your involvement in the University of the West Indies, I want to ask you about the matter of the training of doctors, because I know that very often you hear people say, boy, we're training so many doctors, what are we going to do with all these doctors? Or we're training so many lawyers, what are we going to do with all these lawyers? Clearly, there's a need for doctors.
Certainly. I just also want to point out, so the UWI at the beginning of the pandemic also convened a COVID-19 task force spanning all of the campuses, and it comprises academics, researchers, and experts from multidisciplinary fields. And so some of the questions with respect to the vaccine development, what role the Caribbean has been playing. So for example, at UWI St. Augustine and at UWI Mona, many of the researchers are involved in COVID-19 research, in genome sequencing, in aspects of vaccine development. And I won't speak any further details on it, but certainly we have a UWI COVID-19 website where more information is available. And periodically they've been holding Sunday forums where they share more information. So the concerns about, is this vaccine safe? It's taken such a quick time. There's been a rapid turnaround. So it can help to provide more education and allay some of the fears. Now, with respect to your question, Julian, about the training of doctors, certainly those are one of the professions, and dare I say psychologists as well, that we will never have a lack of demand for. And certainly as we see the changing face, medicine and nature throws these things at us, we will always have a need for doctors. I think sometimes there are logistical issues because you need to have facilities and training spaces for doctors, and it's one of the challenges that the UWI Medical School, as well as medical schools around the globe, have been facing now in terms of how do we deliver quality online training, how do we mitigate the risk for students, given that we're in the pandemic. So it has been a huge challenge, but I must say that the UWI and other universities have been rising to that challenge to ensure that we don't compromise the quality of training, and that we do have doctors as well who will also be able to add what they're learning about the pandemic as one of their competencies.
Let me give Rhonda a chance though to weigh in on the previous question I posed to Adrian regarding the investment in the health sector. Rhonda?
Right. Thank you, Julian. I wanted to say that although, as Adrian said, education would get the bulk of the funding in most times in terms of government budget, but within the health sector, there's some, there could be some discussion on how funds are allocated within health. For example, traditionally, the bulk of the funding in health would go towards primary, not primary care, but secondary and tertiary care. And primary care would normally get not sufficient funding. But I think COVID-19 has shown the importance of primary care and the importance of public health. Public health measures that have worked, hand washing, wearing a face mask, cough and sneeze etiquette, those are things that would work in primary care or on public health. But in traditionally, public health wouldn't get any funding. Public health would be seen as the part of the health budget. Well, those are persons in public health. They could, let's spend the money on tertiary care. Let's buy some more ventilators. Let's buy some more dialysis machines. And if you look at dialysis machines, the investment would be better in primary care, where you can prevent chronic non-communicable diseases rather than waiting for a diabetic patient to get chronic renal failure and have to go on dialysis. So really within the health sector, we really need to look and see how we allocate funding and pay more attention to primary care and public health.
I didn't hear the question, but I would like to agree with what Rhonda said. Preventive care is prevention is always better than cure, and preventive care is what we need to spend a lot of money on, more money on, more resources. And I agree with Rhonda. Public health is normally ignored, and we've seen how much public health has been a focus in this campaign. We need to look at preventive care. We need to get people to eat properly, to exercise well, to cut down on some of the salt and fried foods and fatty foods in the regions, and use our natural resources, the sea, the sand, the sun, uh, and prevent some of these illnesses rather than having to be on the back end and treat the complications of these illnesses. You know, many patients, when they do develop these complications, said, if I had known then now what I know, what I know, if I knew then what I know now, I'd be better off. And that is always, you know, we would give them the information. They say, you know, I'm too young to die, I'm too young to have these complications. And that is a problem that we see regularly. So it's important to do preventive care in treating in dealing with our health problems of the region.
My question to you, which you didn't hear, revolved around the fact of the operation of the private sector in the medical care. And I suggested, for instance, that we may very well see an increase in things such as telemedicine.
Oh, yes. We have started to see a lot of that because in the pandemic, that is one of the modalities that we have been using in patient management. It has developed very, very quickly. And the technology is out there now. Everybody has some sort of device that we can use. And there are, of course, limitations. As we get more accustomed, we'll be better able to use it. But yes, telemedicine is something that is being used in Barbados and other islands in the Caribbean, other countries in the Caribbean. So it's something that we will see more of in the future.
All right, somebody just posed a question about suggesting that CARICOM needs to have a real special communication campaign regards COVID and so on. I'm going to ask Rhonda to weigh in on that, because obviously I know that many people don't associate CARPHA with CARICOM, for instance, and that I know is a problem of identification. But I think, Rhonda, may be a chance for you to explain exactly the resources that are regionally available to every one of the countries in the region in dealing not just with COVID, but with all kind of health challenges.
Okay, so you mentioned CARPHA, Julian, and CARPHA is really the Caribbean Public Health Agency. It is an agency of CARICOM, the Caribbean community, and CARPHA is our public health agency. It's the agency that provides technical advice and support to member states in the region on public health matters like dengue, chikungunya, Zika, COVID-19. An important role that CARPHA plays is the reference laboratory that many countries in the region, including Antigua and Barbuda, although we do our own PCR testing here, we also send some of our samples to CARPHA for validation and for testing to CARPHA. In terms of other public health resources in the region, we have the Pan American Health Organization that's based in Barbados. PAHO, as you know, is the regional office of the Americas of the World Health Organization. And PAHO in Barbados serves Barbados and the Eastern Caribbean, and the larger territories in Guyana and Trinidad, they have their own PAHO offices. And PAHO provides mostly technical advice to member states on public health issues. So, for example, for COVID, PAHO has provided a lot of technical support to Antigua and Barbuda. They've given us supplies, they've given us testing machines, personal protective equipment, and they've sent experts to Antigua and Barbuda. In fact, our infectious disease center, where we now house our COVID patients, PAHO has assisted us with the design of that facility. They've assisted us with, training. I mean, PAHO has just been very valuable to the region and to Antigua and Barbuda over the years. So CARPHA, PAHO, you have other agencies in the region that would assist countries with public health issues. You have UNFPA, you have USAID as well. They have offices as well. They have CDC as well in Barbados, a regional office that provides technical support to countries in the Caribbean. And public education, I think you mentioned in the first part of your question, Julian. Public education is important, and CARICOM has a role to play. CARPHA has a role to play. They provide a lot of education for medical practitioners in countries, and they also provide a lot of technical documents that can be used by member states to educate the public.
Well, I'm glad you mentioned the CDC, because that might trigger a better understanding, for instance, of what the CARPHA institution is in our region.
You're right. So the CARPHA is the Caribbean CDC. It's our public health agency.
Good. All right. Now we got a couple of minutes left, and I just want to go around the table, so to speak, this virtual table, and I want all of you to give a message to the populace about the importance of focusing on the threats, not just COVID, but every other health threat, and why they should take measures to ensure that we really create a very healthy Caribbean nation. Let me go first to you, Adrian.
Yes, thank you very much for this opportunity. I think we need to recognize that it's not only COVID-19, but we need to look at your it's just like, you can't focus on your toe. Yes, you need your toes to walk, but you need to look at the whole body. And similarly, we need to look at the comprehensive health situation in the country and the region, and so that every little bit counts. So we need to look at our whole body, our whole the whole number of health conditions that there are, because everything can impact on the overall health of the nation. So the health of the nation is very important. Your total health is very important. Of course, there's COVID there that we need to recognize, and with the vaccines, we'll deal with those as they come along.
All right, Khadija Khan in Port of Spain.
Yes. So, it's estimated that 1 in every 4 persons will deal with a mental health challenge in their lifetime. So while the risk of COVID-19 right now is very pressing and urgent, we're also at risk for preserving our mental health. So I do urge persons to monitor their levels of stress, and it can affect us psychologically, cognitively, in terms of how we think. It can affect us physically. It can affect our interactions with others. So I think it's really important that we learn how to manage our stress, that during these trying times where we have all of these restrictions, that we have good conflict management, that we know how to support children who are struggling, that we are supportive, that we are brothers and sisters keepers, that we encourage people to comply with the public health prevention measures. Everybody's a little bit exhausted. There's this term COVID fatigue, and it's not a physical fatigue, it's more of a psychological fatigue. We're a bit tired. We'd like life to go back to how it was. We hear about this new normal, but what exactly is this new normal? It keeps shifting. So there's still some uncertainty, and so we really need to pay attention to our mental health. We don't want people just surviving and getting by. We do want people to thrive even in these challenging times. And so let's put mental health also as a priority. There's a saying, there's no health without mental health, and I'd just like to endorse that again.
All right. Thank you very much, Katrika. Let's then have Rhonda. You get the first and the last word, Rhonda.
This statement always captivated me. And I think it came out of the Nassau Declaration. The health of the region is the wealth of the region. And when I speak of health, it's not just the absence of disease, but according to the World Health Organization, it's complete mental, social, and physical well-being. And we should all try to attain that, not to say we don't have a disease, but to be physically well, mentally well, and socially well. And with COVID-19, I want that for all of the Caribbean. I want us to get out of this pandemic and to be healthy and contribute to the wealth of the region.
Well, that's our conversation for this week. And thanks to my guest, and thanks to all of you for joining us across the region and beyond. And I want to say a special thanks to my production team as well. I'm Julian Rogers in Kingston, Jamaica, reminding you to catch The Living Room on Sunday afternoons from West Indies Global. You like them as you like us on Caribbean Bridges. Be safe, everybody.